A baby's urine can provide important information about the baby's health. In a healthy and well-fed baby, urine is yellow in color and odorless. If the baby has not received enough breast milk and has lost too much weight in the first week, they may start to produce more concentrated and darker urine, and pinkish stains may appear on their nappy. These pinkish stains can frighten mothers, but in fact, this is a condition we call urate crystals, and it is an indication that the baby is not getting enough fluids. However, is the pink or pinkish-red staining on the baby's nappy blood, or is it urate crystals? To make a definite distinction, a urine test may be necessary. Most babies urinate within the first few hours after birth. However, if the baby has not urinated within the first 24 hours, this could be a sign of a kidney disorder. Therefore, monitoring this is important, and having 5 or 6 wet nappies within 24 hours is an indication that the baby is feeding well and that their kidneys are functioning normally. It is also important if the baby's urine is tea-colored. Especially in a jaundiced baby, the presence of this type of dark-colored urine is an indication that there is bilirubin in the urine. We said that urine is odorless, but in cases where there is consanguineous marriage, the risk of certain metabolic diseases increases, and in some metabolic diseases, there is a distinctive smell in the urine. In books, this may be described as the smell of sweaty feet or the aroma of pastrami seasoning. If your baby's urine has this kind of unusual smell, you must inform your doctor. The presence of a smell in the baby's urine, the baby being unsettled, not feeding well, not gaining weight properly, or developing a fever may be due to a urinary tract infection. In such a case, a full urine analysis and urine culture should be performed, and if bacteria are detected, it should be treated with antibiotics. When a baby has a urinary tract infection, it is necessary to perform a bladder and kidney ultrasound to determine whether this is caused by an anatomical problem. In some kidneys, there is a condition known as urinary reflux. Urine can flow back from the bladder towards the kidneys. This can lead to damage developing in the kidneys. For this reason, babies who have had a urinary tract infection need to be monitored carefully. Sometimes, ultrasounds performed during pregnancy reveal that the baby's kidneys are enlarged. This situation needs to be clarified after birth. Although it is usually a temporary condition, it can sometimes indicate significant problems and requires investigation for urinary reflux. Having a urinary tract infection in the first year, or the presence of urinary reflux in the kidneys, poses a risk for the development of kidney damage in the baby, and the development of kidney damage can lead to high blood pressure problems in adulthood. For this reason, problems related to urine and the urinary tract in babies must be monitored carefully.